Hello, everyone. Hello, everyone. So it's Monday. It's day 9 of the Dr. Joanne Lewis Foundation Heart Disease Awareness Walk. And we got to get it in where we can. Okay, so decide to get it in while I'm at work on my break. And so to encourage you to walk with us for at least 15 minutes a day. Like I always say, we would prefer that you walk with us for 30 minutes or more a day. But for right now, we'll take what we can and we encourage you to walk for at least 15 minutes. And you can go at a slow pace, you can go at a faster pace, but 15 minutes a day. So we, during this time, always take a few minutes to discuss some heart disease related topic with you. And sometimes, depending on what's going on um, in the world, I have to divert from that and just talk about it, because we've had a few things going on that I had to mention. So if you want to know what they're about, you can look at the other sessions. But today we're going to focus on something very specific, and that's basically the link between stress and heart disease. Because, as I said, today's Monday. Most of us are back at work. Some of us, depending what football team you were rooting for, you were a little bit stressed out last night, eating too much chicken fingers and chicken wings, whatever that people eat during the Super Bowl. But I wanted to focus just a little bit on stress, and because some of us live with a whole bunch of stress, and some of us are under chronic stress, and chronic stress triggers persistent activation of what we call the fight or flight response. Okay, so and it raises the level of our cortisol and adrenaline, and this leads to elevated heart rate, and our blood pressure goes up. And if you are reading a lot nowadays, the relationship between inflammation and heart disease and high blood pressure and diabetes. So the fight or flight response triggers that inflammation also, and what's called endothelial dysfunction and increased arterial plaque formation, and all of these contribute to heart disease. And so it's very important for us to be aware of it, and the impact of stress. And sometimes some of the behavioral factors where stress often drives unhealthy coping mechanism. So because of stress, some of us think that we should smoke, we should overeat, we lead a sedentary lifestyle where we just sit around all day instead of getting up and walking. And so some of us, because of stress, we don't adhere to our medication regimen, and that can be problematic, okay? Because all of these things can lead to hypertension, diabetes, obesity, high cholesterol, and all of that. And so stress can cause some cardiac events. So acute stress can trigger like a heart attack, right? And then we have mental stress, especially some people who have coronary artery disease. Sometimes mental stress can make it even worse. And it puts us at risk of having future heart attacks. So we really have to find ways. There are also some hormonal factors, elevated stress hormones like cortisol, epinephrine, that are associated with heart disease. So there are a lot of studies that show this risk evidence from that stress can induce a lot of cardiovascular events. So I'm not going to keep you too long, because I encourage you to walk 15 minutes, but the videos can't be 15 minutes. So keep all of that abreast, and let me just answer this call real quick. And so one thing that I want to leave you with, though, before I let you go, is to exercise. Exercise improves your blood pressure. It can help reduce stress. It can enhance your heart health. You know, I'm about to turn 58, and so it's very important, people, especially my age, to keep moving. And one of something else that's very important to me is just mindfulness and meditation. I am in the center of everything that I do with God. Okay, so I say centered with God. God helps me to cope, and you may develop other coping mechanisms, but prayer, meditation, mindfulness can lower your blood pressure and it can lower your stress. There's also cognitive behavioral therapy, especially dealing with depression. There's a lot of depression if you do have heart disease, so you may want some cognitive behavioral therapy. And just some other psychological interventions, like you may want to go to cardiac rehab, and they really help deal with anxiety, depression, and PTSD. And there's also pharmacotherapy, which if we can do anything to help prevent these heart disease, then we won't need to delve into that. So this is getting a little bit too long, the video, but continue to walk. I'll continue to walk with you, and I'll see you tomorrow. Don't forget to tune in tomorrow evening for our presentation on Zoom and Facebook Live with Dr. Sajine Bien-Aimé regarding heart health. Take care. Love you all. Stay safe.